Good morning. Today we're going to speak about thoracic outlet syndrome. This is a condition where people don't realize that it is happening in the background and they have symptoms from it. And the most common presentations of tingling in the arm with swelling. At times they can't lift their arm above their shoulder. And you can even have like changing color in the hand and the forearm, and this continues on. And people who do strenuous activities like in the gym or have a job that involves lifting arm above the shoulder, their condition as time progress gets worse. And it's important that you need to realize that thoracic outlet can be presenting from the shoulder to the upper arm, and it goes to the forearm and to the fingers. It's a total radiating pain that starts from the top of the shoulder, goes down to the fingers, and people can present with loss of grip. And it happens, it's commonly seen even with people who do long hours of office work. It's people who have a very rounded shoulder when the thoracic outlet is very compressed and closed. So there is no room for the structures that are under the collarbone to move freely. So it's important to maintain a neutral position. That's like an elongated S shape of the spine. Now you can see here that the model is maintaining a neutral spine, keeping the shoulders relaxed in level with the ear. But for people who work long hours, sometimes because of weak core, they tend to bend forward and you lose, and it becomes more of a C shape rather than an elongated S. And that brings on the symptoms. And that's when they say when they sit for 30-40 minutes, the arm starts to feel tingly. And it's essential that you start working and correcting the posture using physio approaches, advices and tips. Exercises which release the thoracic pressure, taking off the nerve compression pressure, is always the beneficial aspect of managing thoracic outlet syndrome. And also having a good cardiothoracic expansion, having cardiothoracic exercises, keeping a good fitness is important. And the main thing is to contact a healthcare professional. If you think you have any of these signs and symptoms, you can contact us at Physio Services, Stanway, Colchester, and we can always chat to you about the best management possible and get you to the right treatment or right diagnosis if we suspect that this could be a condition of thoracic outlet syndrome. And people who are young, athletic, and people who are working out in a lot of gym work, exercises, it would be important that you take note of any of these symptoms that are presenting and contact us immediately. Thank you for watching this video.